Bite Guy.
Tuning in now with the Bite Guy.
The Bite Guy. There's your podcast title.
The Bite Guy.
Hello and welcome. I'm Dr. Daron Clark at Downtown Dental, and we have a very special guest with us today, our newest dentist who's joined the practice, Dr. Nikki Currie.
Thanks for having me.
All right, so I thought we would take this opportunity to sort of just introduce you to the patients and everybody watching. So tell us a little bit about yourself, where you're from, what you like, what you don't like, Nikki in a nutshell.
Yeah. In a nutshell, I grew up on the West Coast, but I did all my schooling, lived the last 10 years in Colorado. I did a residency with University of Tennessee, and that brought me here. I've practiced in the greater Nashville area for about 3 years now, but at Downtown Dental for about 2 months now.
Yeah.
So I'm happy to be here.
It's going very well. We're very happy you're here.
Great.
Okay, so one thing I thought we would do today is let's just run through some of the common questions that we get from patients on a day-to-day basis. And we'll give some answers just to give some information, right? So one of the first ones is, why does my tooth hurt when I bite down, but not all the time? So the answer to that is, and you know this, there's a nerve in the tooth. And if there's anything wrong with the tooth that could affect the nerve, like if there's a cavity there, if there's a fracture in the tooth, any sort of contact on it is going to set that nerve off, and then you're going to get some tooth pain. Okay, now it's your turn. Your first question is, why do I keep getting cavities even though I brush and floss?
That's a great question. I feel like I get this quite a bit.
A lot.
Cavities are multifactorial. Where they come from is a lot of different reasons. Sometimes it's your diet, sometimes it's your hygiene, but that's where we get that, because patients are saying, I'm brushing, I'm flossing all the time. Why am I still getting this? There are other factors at play here that could be contributing to it. Medications you take that cause a dry mouth. If you don't have saliva there to help wash this bacteria away, you're going to get cavities. Clenchers and grinders, are putting so much force on these restorations in these teeth. They're more prone to cavities. Bacterial makeup, genetics, there's a lot that contribute to it other than just, do I brush my teeth? Do I floss my teeth?
You bring up a really good point with the dry mouth component. And it doesn't have to be medication, right? It could be that you're mouth breathing at night and you have dry mouth for periods of the day. And the important point here is that there are things that are affecting people having cavities that are not just their cleaning habits. But it also doesn't mean that we can't change the effect of those things, that we can't identify what's happening and address them and sort of get people off this hamster wheel where they're just having cavities every time they come in, despite all of the hard work that they're doing to prevent it. Okay, next question. This one's for you. Why do my teeth feel more sensitive after cleanings, and is that normal?
It can be normal for some, but not normal for others. I feel like the biggest factor in that is how much buildup you have on your teeth and how long between cleanings are you going. Buildup is, hardened plaque on the teeth, bacteria there, and it can be kind of insulating to the tooth. It's like that winter jacket, but it's full of bacteria. It's causing more harm than it's doing good. So patients get it removed at a dental cleaning. And after the fact, it feels a little sensitive and feels hot, cold. It's because you've been having bacteria sitting on your teeth, keeping them warm. Your teeth adjust after the cleaning. But it is a little bit common if you have a lot of buildup to have that hot, cold sensitivity after the fact.
Yeah, that's right. And the other piece of this is when you have that buildup on those teeth and the bacteria are there, there's an acidic component to it that's actually pulling minerals out of the tooth. And the minerals are what give us a lot of our thermal and sensitivity protection. So it's really important that we're using a remineralizing toothpaste after your cleanings to build up that resilience again. Okay, next question is for you. Why does food keep getting stuck between my teeth if I'm flossing every day?
If you struggle with food getting caught in between your teeth, it can be for a couple different reasons, but a big one is if you struggle with periodontal disease or advanced gum disease, you're going to notice your gums start to shrink down the tooth a little bit following the bone loss that you have. This leaves more room for food to get caught in areas that are normally covered up by gum and bone. If you have really advanced periodontal disease and you've been losing teeth start to shift in those places, and you're going to get more and more space between where your teeth used to sit, and that leaves more and more space for food to sit.
Yeah, it's an infuriating problem for people when they have it. Seems like it, because what we hear people say is that they go out to eat, and every time they go out to eat, they can't concentrate on the conversation because they've got food stuck in their teeth, and it's awkward to be trying to get it out at the table.
And in part of it can be not even if you struggle with periodontal disease too, if anatomically you just have an area that isn't filled in by tooth, that food gets stuck, or an oddly shaped crown or an oddly shaped filling. Those are things that are fixable. We just have to, fill that space in so that food doesn't get caught.
Yeah. Or if you're missing a filling, like sometimes these things fall out, and that's definitely going to trap a lot of food. The last thing that affects this for some people is if their teeth don't come together in an efficient way, so their bite is not ideal, then there are going to be areas where they're going to get food trapped, especially if there's crowding. Those areas, just like I said earlier, it's like so infuriating. I've dealt with this, because you'll have one area and you sit down to eat, and it's usually like salad or like fibrous meats, and you're like, I'm really going to enjoy this for 5 minutes until I have something stuck in my teeth, and then I'm going to fight it for the rest of the meal.
Yeah, absolutely.
Okay, next question is, why do I have headaches but no obvious dental problem? And usually the answer to that is, I'm going to back up. So 85% of headaches, if not more, are extracranial, which means that they're caused by something outside of your brain. And a lot of those are caused by extra muscle activity. Because if the muscles are clenching and grinding and never really getting to rest, then just like if you run a marathon, your leg muscles are going to be sore. If the muscles never get to rest, they're going to get tired and they're going to get sore. And that can cause headaches just in and of itself. That is the classic way that somebody gets what's called a type 1 tension headache. Okay, next question. Why do my gums recede even though I'm not that old?
That's a great misconception. You do not have to be old to have recession. You can be young and have recession. It could be a force issue. If you are constantly clenching and grinding, you're going to notice some recession of the gums. If you are constantly brushing the heck out of your teeth, hard bristled toothbrush, using a lot of force, you can abrade away the gums there. Lastly, if you have some bone loss, tissue follows the hard, soft tissue follows the hard tissue. So if you have some bone loss, your gums are going to follow that bone, and you're going to have a little bit of recession as well.
That's right. And you made a really good point with this. It's not that the gums are going away. It's that the bone below the gums is going away, and the gums just have to follow it down. And what it boils down to is that there's two main reasons that this might happen. One is too much bad force on the teeth that gets delivered to the bone. And then the other one is if there's gum disease, it's bad enough to start that bone loss process. Okay, next question. We get this all the time. Why does my bite feel off after I have dental work done?
Okay, this is really common. Patients feeling like their bite isn't normal after fillings, crowns. We try our darndest as clinicians to rebuild the exact shape that you have before. And we have a lot of technology and things here that help us with it. We have bite paper, we have T-scans, things like that. But at the fact of the matter of, even if it's off in micrometers, someone's bite is going to feel it. Our mouth is a very, very sensitive area. And let's be honest, 90% of the time when we end an appointment and say, how does your bite feel? You're numb. So you're, going to think it feels normal, and it doesn't. What's important is that you don't go with your bite feeling misaligned. You want to get that back to normal. It's a quick, easy fix when you're not numb. That way we can tell exactly what fits right for you. And we have a lot of technology here to help us out with that.
Yep, that's right. The other thing that I see just from my TMD perspective with this is if there's a significant amount of work that needs to be done and we have to have our mouth open for quite a while, that really changes your muscle tone. And if for a short period of time after that appointment's over, plus you like with the added effect of you being numb, the bite just, with the muscles not functioning correctly and you don't have the same feedback happening as you normally would, it'll just feel like the bite's landing in a different spot for a little while. And what I usually tell patients is, okay, This is really, really close, if not dialed in. But after you have a meal or like give this a couple of days to sort out. But if in a week it's not better and you still feel like it's off, or if you're getting some sensitivity when you bite down, then give us a call and we'll get you back in and we'll check it and do any adjustments that we need to do.
A test drive.
Yes, a test drive. More and more and more and more we get this question. Can you heal cavities naturally? And we've got to get some clarification on this statement before we get into answering. But yes, you can, but also it depends on what you mean by heal and what you mean by naturally. So healing in that, can you have a big, huge cavity in a tooth and do something to make all the tooth structure grow back? No, that's not how it works. There are people doing research on this, but this is not available, and it's going to be, if we do figure out how to do it, it's going to be quite a while until we do. But what we have available to us right now, and I'm going to define heal as remineralizing the part of the tooth where the cavity is. Yes, we can do that, and it builds some resilience in that area. And the other component of this is like, how big is the cavity, right? Because if it's barely into the enamel, and things like our remineralization paste, like hydroxyapatite, or there's a whole host of things that are on the market right now. If we have topical access to it by using some of these products, then we can remineralize those areas, and it will stop the growth of the cavity and strengthen that part of the tooth. It'll never be the beautiful enamel that it was before on a microscopic level, but it will be resilient and you can stop that process. But if it's deep, if it's through the enamel already into the underlying tooth structure, we don't have a lot available to quote unquote heal those areas. There is a product on the market called SDF, which is silver diamine fluoride, that we can treat those areas with, and it kills the bacteria, but it does nothing to really remineralize the tooth. And the other issue with a lot of the SDF products is that they turn that part of the tooth really dark. So there are options out there. The answer is yes, there are some options out there, but it depends on the depth of the decay and also like, what are you willing to do to stop it?
Yeah. I think it's worth mentioning too that if you're going to use these over-the-counter products or prescription products for that matter, read the instructions. You know, 100%. A lot of them change product to product. Some of these products need to be used for 20 minutes. So if you're not using it for the full 20 minutes that it's prescribed for, then you're not going to see the outcomes that you want to. Some of them are don't rinse after brushing. So if you're going to use it and you want to see results, just read the instructions for use.
Yes. Yes. It's very important. I never read instructions. There's a hot trend out there. It's a hot trend about toothpaste. There's a hot trend out there about like dumping your toothpaste, like not buying the over-the-counter fluoride, non-fluoride, Tums, Crest, all the stuff, and just like using natural things at home. There's baking soda. There's activated charcoal. There are all of these things out there right now that people are kind of trying to transition to. And there's a couple of really important points with this. One, I think it's really important. I have this conversation with patients all the time. It's important to understand like what's actually cleaning your teeth, because it's not the brush bristles. It's the graininess of the paste that's actually cleaning and polishing the teeth. So anything that is safe to be in your mouth and has this sort of grainy quality to it and can be mixed in with water and delivered as a paste conceivably could work as something to clean your teeth, because the brush's purpose is to just agitate the paste to clean the teeth. Now, the next question becomes is, well, what else is in that grainy paste? And fluoride has been around for a long time. We know a lot more about it now than we did in years before. There are other options out there like hydroxyapatite in a paste form. There is calcium in a paste form. The real question is specific to the patient. Like, what are their specific circumstances and what mode of toothpaste is going to best benefit them in their specific circumstances to keep them from getting cavities? And importantly, make sure that it's in line with their philosophy of how they want to take care of their body. And we have a lot of knowledge here at the office about these things, and it's a conversation that we have all the time.
Absolutely. I think it's worth mentioning to I think you bring up a great point that not every product is going to fit every patient, and there's going to be some discrepancy between what people use. I think there's two things that we do know. No toothpaste is bad. Like you said, if you're just brushing with no paste, it's not as effective as you want it to be. There's a lot of science that says charcoal toothpaste is a little too abrasive as well.
That's right.
So I would kind of caution patients that are really into the charcoal toothpastes. They can sometimes be a little bit too damaging to your teeth. I would maybe suggest something a little bit.
You don't want like super grainy sand.
Yeah.
You want like soft pumicy sand.
Yeah.
That's what you're going for. Because you're right, anything that's too abrasive is actually going to slowly damage the enamel over time.
So I feel like hot topic everywhere you look right now, Ozempic.
Yes.
And we're seeing it in dental clinics right now. They're saying that patients on Ozempic are thirsty all the time because you're having decrease in appetite, decrease in, I'm going to start over. Okay. Another super hot topic that I'm seeing right now, Ozempic, and we're seeing it here in the dental clinics.
For sure.
Side effects of taking this drug is you have a decreased appetite, you're feeling full longer, so you're not as thirsty. We're seeing a lot of dry mouth. As we know, there's a lot of rampant caries, a lot of cavity issues if you have a dry mouth. Additionally, a lot of people are feeling nauseous all the time on Ozempic, and they're having a lot of vomiting. That high acidity in the mouth constantly is causing a lot of erosion, a lot of pitting out of teeth. I am not an Ozempic hater. I think, if it's a medication that people need to use, that's wonderful. You just have to be aware of the side effects of it. Drinking water constantly, even if you feel full, you just have to remind yourself, set timers on your phone.
This brings up a good point. A couple of good points that I talk about with patients all the time. One is no prescription medication only does one thing. Every prescription medication does a lot of different things, but it is prescribed to you because we know it will do the one thing that will help what you were at the doctor for. There is a global effect on the body with any medication that you take, and a long list of them, like Ozempic, one way or another will cause dry mouth issues. And I've never seen anything change a patient from not being cavity prone to showing up one day out of nowhere with a mouthful of cavities, like dry mouth will. And it almost doesn't really even matter what the reason is. The other component to this is relatively new medications have been tested before they're put on the market. However, you can't test a medication for 30 years and understand what those long-term side effects are going to be. So we've got to keep that kind of stuff in mind as we see new medications come on the market. We have to be watching for what's happening to our mouths, and from our perspective, watching what's happening with our patients' dental health as they've been on these medications for a longer period of time. The one that pops into my head that we deal with over and over again is bisphosphonate medications, which are prescribed for osteoporosis. And we learned years and years later, after these things were on the market, that if you have to have a tooth taken out after you've been on some of these medications for a long time, you're at very, very high risk for an unresolvable infection, even when that surgery goes well. So the big picture with this is any prescription medications you take are going to have an impact on your oral health. And from a patient perspective, these are things we need to be asking our physicians about and asking our dentist about, so that we make sure we are being proactive in positioning ourselves so that those likely adverse effects have minimal impact on us.
Absolutely. Okay, same-day dentistry. One of the best advancements in dental technology right now is in-office laboratories, in-office milling. This helps us cut out so much in-between time when you're in the middle of restorative appointments. For example, a lot of the times we used to have to prep some crowns or onlays or teeth For example, we used to have to prep teeth on a single day and send information and materials to the lab, and then we would get back the material 2 weeks after the fact. That means there's 2 surgical appointments for that patient. There's downtime, you're wearing temporaries, you're wearing flimsy things. We have the technology here to do it all in one appointment. You come in, the tooth is prepped, you hang out, you watch a video, you watch your TikToks, and then the crown is there for you. You leave that day with the crown that you need, or the onlay, or whatever porcelain unit we're able to mill for you in office. There's no more of this downtime, multiple appointments business. It really makes it easier on the patient, makes it easier on clinicians. It's all around just a really great advancement.
Being able to do this stuff in office has been a huge asset for us, and it's an incredible asset for the patients. And the cool part of it is these things are either milled or they're 3D printed. But to get to that point, that means that they're digitally designed. And when we have the ability to digitally design these restorations instead of just sort of packing a bunch of material into a tooth and then trying to cure it and shape it, we have a lot more accuracy, we get a lot better restoration, and patients get a lot more longevity out of what we're doing. So it's a lot of fun for us as dentists to be able to do it, but it's also like it's such a better result for the patients in the immediate and the long term. And then obviously, like, you avoid another trip to the dentist and you avoid another injection and all of the things that were part and parcel to the process before we had this technology available to us. Yeah. So the milling systems that we're talking about are actually a mill with like a tool, like a burr, that is moving around a block and sort of kind of grinding away the block into the shape of it. It's sculpting a crown or sculpting a restoration from a block that's in the machine. And the great part about it is the materials are really strong. They work very well for what we need them to. We can do it in 45 minutes to an hour in the office. And the accuracy of the fit is all but perfect because all of these things are digitally designed before they're sent to the mill. So it's been a real game changer in dentistry. And it's all of these are the reasons that we've invested in this technology and that we've made it part of what we do here every day at Downtown Dental.
Not to mention the fact that if you're doing in-office milling, if you're doing in-office printing, the digital scans, digital impressions, we no longer go the goo route. Gaggers rejoice. The scans make a world of a difference in the whole start to finish process. Yeah.
And we have recent studies out that show that the scanners that we have now, the scans are actually more accurate. The result of them is more accurate and more precise than what we were getting for years with taking impressions and pouring up models in stone. And it's also so much faster.
Yeah.
The thing that I'm really excited about, the most recent technology evolution in dentistry, is 3D printing. And it has been one of the most powerful things that I've seen from a technology standpoint in dentistry in years and years and years. And the reason is because we can make anything out of it and just 3D print it, whether it's a night guard, whether it's a filling, whether it's a crown, whether it's a surgical guide that we use to make sure that when we place an implant, it goes exactly where we want it at the exact depth in the exact place that we planned. It's been a real game changer for us. And it also has impact on what we were talking about earlier with the scanners, because we can scan things and then 3D print a model rather than having to take this physical impression and pour it up in stone. The 3D printing process takes 20 to 30 minutes, and the impression is a very difficult experience for the patient. And then it takes hours to get the stone poured up and actually get to something that you can work with. It's been a real game changer for dentistry.
And I think it's to note, too, that we can make it the first time and then we can make it again. If you're losing some of these items, we just a reprint. We have all of these records in office. You couldn't historically keep stone model after stone model after stone model.
Yeah.
Now we have it all in your file.
That's right. It makes it very convenient when the dog eats your night guard.
Absolutely.
Or you leave it on vacation. Or if something happens and a filling breaks. It's an easy thing to fix now. I do want to take a minute and talk about digital smile design. Most people have kind of heard that this is a thing, but it also, like, if you haven't seen it in action, it just seems kind of ethereal and you don't really know what's happening. And we now have the ability to take pictures and three-dimensional scans of the patient's teeth and put all of it together and design a smile for that patient before we've ever actually touched the tooth. And they can see it. We can show them pictures of what they're going to look like with this smile, with these new, if they were going to do veneers, what the veneers are going to look like on their face, shape, size, color, everything. And if we think about this from a consumer standpoint, this is like the most important part of this, part of the especially with cosmetics, that's ever happened, because the biggest fear people have that keep people from making this decision and diving in is the fear of regret, that they're not going to like what they have. And they will have committed to this process and gone through it and paid all this money. And then they're worried they're not going to like where they end up. Now we have the ability to show people what their smile is going to look like before we've ever really done anything.
Yeah.
And it just makes it an easier decision for them.
You're going to like the way you look. I guarantee it.
That's right. So let's get away from the specific dental questions for a minute. And let's talk about another kind of set of questions that we get all the time here in the office, because patients come in and they see it, and it's the technology that we have here. So let's talk a little bit about these pieces of dental technology that we have in the office that, I mean, make our work exciting, give the patients a better outcome. Let's talk about what like your favorite pieces of that are.
You're trying to geek out.
I would like to geek out right now. Yes.
I feel like first and foremost, we got to bring up the CBCT, 3D imaging.
100%.
Helps us look at teeth, bone, airways, everything. Anything that we couldn't used to see in 2D, we can now see in a 3D.
Yeah. And very importantly to that point, the CT machine we have here in the office allows us to do that, allows us to get all of this incredible information in 3D, but at an exceedingly low dose of radiation, like incredibly safe dose of radiation that frankly, before 5-10 years ago wasn't available to us. So we feel much better about taking x-rays and getting the information that we need, because we know that we are delivering a very, very low dose of radiation. And this is a huge benefit to the patient because we can diagnose things correctly the first time instead of trying to figure out what's going on without having that three-dimensional x-ray to view. Another question we get from patients all the time is like, because they hear us say these things in the office and we kind of run around like the military. We have our own terminology for all this stuff. But we get this a lot. What is an onlay?
Yeah. So in the kind of hierarchy of our treatment, we have people know what fillings are and people know what crowns are. In the middle of this is kind of where onlays sit.
Yeah.
It's a little bit bigger than a filling, but a lot stronger than a filling, but it's a lot more conservative than a crown. It lets us give a restoration the strength that we're looking for, kind of like a crown. It's porcelain. It handles force a lot better than a filling material, but it's not as... it doesn't take away as much of the tooth like a crown does. A crown has to sit over the entire tooth structure. So we're taking away healthy tooth structure. We only have to take away the part that we need to when we do an onlay. Not everybody, not all dentists know how to do onlays, and or not all dentists have the capacity to do an onlay because they don't have the digital technology. You know, scanning and same day placement makes a world of a difference, because doing onlays with temporaries and things like that kind of get messy. It's a lot easier to do it all in one appointment.
That's right. It's a really good point. The way I usually explain this to patients is, for decades, the only options we had was a small filling, or if what needed to be restored in a tooth got outside of what the filling was capable of, then we had to do a crown. And to the point you made earlier, what that means is we had to cut away all of this healthy tooth structure to get to a crown, even though the filling was close to being enough, but it just couldn't quite do the job. And now that we can do onlays here in the office, that gives us the ability to do what we call conservative adhesive dentistry, meaning we only remove the tooth structure that we absolutely have to. We want that restoration to land on a solid foundation of healthy tooth structure. and we can make this piece, this porcelain piece, fit into that area like a puzzle piece, and it gets bonded to the tooth and sealed just like a filling in a crown does. And there's really good data out there that shows that the more conservative we are with how much tooth structure we remove, the longer the life of that tooth will be. And this has been like an incredible asset to us and to the patients to be able to do this conservative dentistry in office. Like it just like when I remember being in dental school and a filling broke and then one little piece of the tooth broke beside it, but you can't put a filling in that spot because it would be too big of a filling for us to expect it to last. And I just remember thinking, why am I cutting all this healthy tooth structure away just because that filling had to get a little bit bigger? And this is like the perfect solution for it. Mm-hmm. Okay, thanks for spending some time with us today. Dr. Currie, we are so happy to have you on the team, and we've had a wonderful time working with you so far, and we know it's only going to get better. If any of you have any questions about any of the things that we talked about today, just leave the question in the comments, and we will get to them the next time we do a session. Thanks again.